Dry it and cover it with a bedpan cover or towel. With the side rail up on the opposite side of the bed, raise the bed to a comfortable working height. If the patient is mobile in bed and can assist, help her into a supine position and raise the head of the bed 30 to 60 degrees. Lower the top linens so they are out of the way, but do not expose the patient more than needed. Then remove the bedpan cover and place it nearby. After powdering the rim of the bedpan to prevent sticking, instruct the patient to flex her knees and lift her hips. If necessary, place one hand, palm up, under her sacrum to help her lift. With your other hand, slip the bedpan under her with its rim facing the foot of the bed. If you're using a fracture pan, slip it under the patient with the narrow end under her sacrum as her hips are raised. If the patient is immobile or has restricted mobility on the bedpan, lower the head of the bed flat if medically appropriate, raise the bed to a good working height, and remove the top linens so you can turn him while minimizing exposure.
If you just take your right arm and reach for that.
Help the patient roll onto one side with his back toward you. With the open rim of the bedpan facing the foot of the bed, place the pan firmly against his buttocks and push it down toward the mattress. Keeping the bedpan centered under the patient with one hand, place your other hand around his hip and help him roll flat on his back onto the bedpan. Do not force the pan under him. Then raise the head of the bed 30 degrees and raise the knee gatch or have the patient bend his knees, unless contraindicated.
And there's your call light when you're done. You can get your toilet paper. Thank you.
With the patient comfortably resting on the bedpan, cover her for warmth. Make sure she can easily reach the call light and toilet tissue, and teach her to wipe from front to back to prevent the transmission of anal bacteria to the urinary tract. Remove your gloves and ensure that the bed is in the lowest position with the side rails up. Now give the patient privacy, but monitor her and respond promptly to her call light. When she signals you, put on a new pair of gloves and position the bedside chair near the working side of the bed. Move the top linens aside, and if the patient is able to wipe her own perineal area, ask her if she has done so. If she is mobile in bed, have her flex her knees and lift her buttocks by shifting her weight onto her feet and upper torso. To help her, lift her sacrum with one hand and hold the side of the bedpan with the other. Then remove the pan, cover it, and place it on the chair. Now help her to perform hand hygiene. If the patient is immobile, lower the head of the bed, hold the bedpan steady, and help him roll onto his side and off the bedpan. Then remove the pan, place it on a towel or bedpan cover, and put them on the chair. If the patient cannot wipe his own perineal area, clean this area from front to back, using toilet tissue or a perineal wipe and noting the skin integrity in the perineal area. Place the used tissue in the bedpan, or in the trash if intake and output are being measured. If needed, perform perineal hygiene. For either type of patient, place the cover on the bedpan as soon as possible. Then change any soiled linens if necessary, and make the patient comfortable. Make sure that the bottom linens are wrinkle-free and that the call light is within the patient's reach.
Okay. Then we'll take care of this. If you need anything else, remember to call Bill List.
Right, thank you so much.
As part of follow-up care, note the characteristics of the patient's stool and urine. If needed, obtain specimens for testing. Finally, empty the bedpan's contents into the toilet and rinse or disinfect the pan according to facility policy. To assist a patient with using a urinal, first provide privacy by closing the bedside curtain or the door to the room.
I'm gonna help you use your urinal.
Then help the patient into an appropriate position, such as standing, sitting on the side of the bed, sitting in bed with the head of the bed elevated, or lying on his side or back. If possible, have the patient hold the urinal and position his penis in it. Provide privacy as safety permits. If you leave the room, remove your gloves and perform hand hygiene. If he needs assistance, hold the urinal for him or position his penis completely within the urinal and hold the urinal in place.
Mr. White, are you all done? Yeah.
After the patient has finished voiding, remove the urinal.
Is there anything I can get for you?
No, I'm good, thanks.
I'll be right back.
If needed, assist him with perineal hygiene. Remember to note the amount, color, and other characteristics of the urine. Then empty the urinal and clean it, using the spray faucet attached to the toilet or as required by facility policy. Once the urinal is clean, dry it with a paper towel and return it to the patient. For easy access, attach it to the side rail. Then remove and dispose of your gloves and perform hand hygiene. Assist the patient to perform hand hygiene and resume a comfortable position in bed. As part of your follow-up care, record the patient's urine volume in the patient record if intake and output are being measured. Monitor for changes in his normal urinary elimination pattern. When preparing for catheter care, be sensitive to the patient's needs. For example, close the bedside curtain to provide privacy. Then raise the bed to a comfortable height for you, and lower the rail on the working side. After putting on clean gloves, cover the patient with a bath blanket positioned in a diamond shape and fan fold the top linens down to her legs. Next, help a female patient into a dorsal recumbent position with her legs relaxed and falling to the sides. For a male patient, use the supine position. Turn back the bottom corner of the bath blanket to expose the patient's perineum. Then have her raise her hips so you can place a waterproof pad under her buttocks. If the patient is unable to raise her hips, assist her in turning from side to side to achieve proper pad placement. Now examine the catheter insertion site for redness and other abnormalities. Check the tubing for patency, secure connections, and sufficient length to avoid tugging on it with leg movement. Also inspect the skin around the tape or catheter strap or under the catheter strap for irritation. Provide routine perineal care according to the video skill entitled Performing Perineal Care for a Female Patient, making sure that all perineal folds are cleansed thoroughly. Wet a clean washcloth with soap and water. With your non-dominant hand, hold the catheter securely near the meatus. With your other hand, clean in a circular motion along the catheter for about 4 inches, working from the meatus toward the drainage bag. Avoid pulling on the catheter tubing. If needed, replace the anchor device that secures the catheter tubing to the patient's leg or abdomen. Next, check the drainage tubing. Make sure that it is coiled and secured to the bed linen, not looped or positioned higher than the bladder, and not kinked or clamped.
Mrs. Greer,
Yes.
I'm going to empty and measure your urine.
All right.
Empty the collection bag at least once every 8 hours. Replace the collection bag and tubing as needed or ordered. Holding the container at eye level, observe the urine for amount, color, and clarity. Document your observations in the patient's medical record. Also ensure that the collection bag is positioned on the lower bed frame and that urine is flowing freely through the tubing. Make sure that the tubing is coiled and secured to the bed linens. Then remove the waterproof pad and return the patient to a position of comfort in bed.
Mrs. Greer,
Yes.
I'm going to check your temperature.
All right.
As part of your follow-up care, perform hand hygiene, put on clean gloves, and regularly monitor the patient's temperature. And observe the color, clarity, and amount of her urine.
Why are they checking the temperature? We're assessing to make sure that the patient has any infection that could possibly be related to the catheter. Is there any questions in regards to urinal use, bedpan use, or catheter care? Yes.
So in the video, I noticed that she's just cleaning her catheter. That's it?
Yes, this is when you would do it during urine.
Oh, okay. So all together. This is just individually, just to give us a better idea.
Right. Any other questions? All right, then you're gonna go back to your group for the mannequin to put your patient on the bed.